Hi, I'm Dr. Victoria Aimé. I'm a plastic surgeon in Scottsdale, Arizona. Today, I'm going to talk to you about a little area that can make a big impact in how youthful you look. It's often overlooked, and that would be our earlobes. So, as we age, those earlobes can lose volume, they can get wrinkled or crease, they can be altered with heavy earrings that can either enlarge the piercing area or tear through completely. They can be changed just by genetics, how fast they grow or how large they are in proportion to your face, and then we can change them with surgery. So if you have a facelift or something like that. So the top 5 ways I would recommend to consider if you want to rejuvenate your earlobes is number 1, if you just want a quick fix and you have lost some volume in your earlobes, I would recommend considering filler, dermal filler. So a hyaluronic acid filler is an easy way to get a nice little revolumization of your earlobes. This will help make your earrings sit a little bit better. It's a very quick procedure. It's relatively painless. And typically we use about maybe 1 syringe, so split between each side of the face, or each earlobe that is. It lasts for about a year. So that's a number 1 quick tip to revolumize your earlobes. Number 2, if you want a little bit longer lasting, more permanent fix, I would recommend fat grafting. So fat grafting is something that we do typically to revolumize the face. And whenever I do that for a patient, I always ask them, do you want me to add a little bit in your earlobes? This is a longer way to get a replumping or revolumization of your earlobes. So it typically plops out any sort of creasing or wrinkling you have, gives a little bit more substance to them. Earrings tend to fall forward if you don't have enough volume in those lobes, and so this helps plump them up, help the earrings sit better. That's number 2. Number 3, I have a lot of patients that have worn heavy earrings or their earrings get caught, pulled on, and that can make the earring piercing sites enlarge or even tear through. So earlobe repair is number 3 on our list. So that can be from just normal daily wear of earrings. That can be from wearing gauges. Either way, what we do typically is we're going to take a little wedge, like a piece of pie or a piece of pizza out, and close that down so it will remove the old piercing. And then what I do is typically re-pierce the ear for patients at about 6 weeks. And then about 6 weeks after that, you can change out the earring to whatever you want. So that's just a typical torn earlobe. If you have a gauged earlobe, that's a little bit more tricky. That requires a little bit more origami of the earlobe to correct it or reconstruct it. Number 4 on the list, I would say, is earlobe reduction. So a lot of patients actually have naturally large earlobes, and a number of patients just get large earlobes with time because our ears continue to grow as we age. So you can actually do an earlobe reduction. So same kind of principle, would take out that little pie wedge, close it down. Sometimes if the earlobes are a little too long, we can also take out a little bit in between. So typically, it's a very straightforward procedure, just like an earlobe repair, in office, under local, go home the same day. And for both of those, we typically take out sutures at about a week. Number 5 on the list is a pixie ear deformity correction. So what this means is when your earlobe is basically stuck down to your face, that can either occur naturally from genetics, or it can be due to a facelift scar pulling down on the earlobe. Either way, basically what we want to do is release that earlobe so that you have a nice little curvature of your earlobe there. Release it from the face skin so that it's kind of its own little unit, and then pull the face skin up to where it should be so that they kind of meet. Not so much kind of like this, but more earlobe meeting the face. So that is an in-office procedure as well that we just do under local. Sutures, again, are removed at 1 week. It's a great way to give a little bit more definition to the area. And a nice quick fix for anyone who has a distorted earlobe from a prior surgery or just from genetics. So those are my top 5 remedies or ways to rejuvenate earlobes. I think that these are all great options, and it's a very overlooked area, but just like our hands, it tends to show aging and wear. It's something to pay attention to and consider, especially since a lot of these procedures are very straightforward, easily done, well tolerated, minimal pain, and in the office. So if you have any questions or comments, feel free to drop them below.